I'm glad you're here. On this channel, we break down and simplify all things medical. My name is Irene Oira, and thank you so much for tuning in. Today, we are going to be talking about heart attack. What are the symptoms you should watch out for? What are the common symptoms that we ignore? And how is it different from panic attack? Because heart attack and panic attack are commonly confused for their symptoms, but there are differences. And today we are going to learn about them. So what is heart attack? Heart attack is a state of the body where blood flow to the heart is severely reduced or blocked. The blockage can happen due to fat buildup or cholesterol. As we all know, with circulation in the body, the blood is responsible for transporting oxygen and nutrients in our body parts. When the blockage happens, blood flow to the heart tissue is limited and the heart tissue dies. So what are the common heart attack symptoms that you may be ignoring? Number one is feeling of a racing heart more recently and very frequently. This happens several times during the day. The second symptom that you might be ignoring is shortness of breath. When you notice that you're feeling short of breath when you perform a certain task that you were previously able to perform, but recently you're not able to perform it as you were due to the shortness of breath, that is also another thing that you should watch out for. The third thing that you should watch out for is feeling tired more often than normal. So you find that you cannot perform tasks as energetic as you used to as compared to the past days. That is also another thing you should watch out for. The fourth thing you should watch out for is feeling pain in a part or parts of your body, but you cannot explain the cause of that pain. That is also another thing you should watch out for. The fifth that you should watch out for is if you have to sleep on pillows or a pillow at night for you to be able to breathe properly and have that comfortable night, then that is also something to watch out for. You find that maybe you are not a pillow person, or you are not used to using pillows, or you've been using pillows, but you find that recently you need to make some adjustments for you to be able to breathe well, for you to have a peaceful night, then that is something that you should not ignore. The sixth and last thing that you are not supposed to ignore is swollen feet and ankles, especially that is associated with the symptoms of heart attack that I'm just about to discuss with you. So these 6 symptoms, let us be careful not to ignore them. Let us be careful not to let it just pass, because it could be a communication with your body that something could not be well. And the faster you go get checked, the safer for you, the safer for us all. So what are the symptoms of heart attack today? The common symptoms of heart attack are, number one, chest pain. And how does this chest pain present? The chest pain presents as a feeling of heaviness, a feeling of pressure or squeezing of the chest that does not go away even with rest. Second symptom of heart attack is shortness of breath. Third, pain in the arm, shoulder, neck, the jaw, and sometimes the back. Fifth is the feeling of dizziness, lightheadedness, or feeling like you want to faint. And sometimes this person actually faints. The fifth, heartburn and indigestion that happens gradually. Sixth symptom of heart attack, fatigue. Seventh symptom, you may be experiencing stomach pain, nausea, or vomiting. So when you find that you have these symptoms, it is good to make an informed decision concerning your health. So is it a heart attack or a panic attack? And how do we tell the difference? Both of them present with chest pain. But now in heart attack, the pain presents as heaviness, pressure or squeezing of the chest. But in panic attack, it presents as a sharp stabbing pain. In heart attack, the pain is progressive and does not get better even by changing position or taking a rest. But in panic attack, the pain gets better with time. For heart attack, most of the time, the symptoms are triggered by physical activity, maybe by running, jogging, generally working out, or activity that will require the use of the muscles of your body. But in panic attack, mostly the symptoms are triggered by stress. Another difference between the two is, remember, in heart attack, we talked of having symptoms that presents as pain in the arm, shoulder, neck, and jaw. But in panic attack, mostly the pain presents as tingling sensations in the hands.